Welcome to today's episode of the Fellows Forum podcast. Today we have another episode of our Fellow of the Month series where we spotlight a member of the community every month. Our Fellow of the Month for March is Dr. Mehndi Dandwani, who is a first-year Hematology Oncology Fellow at the University of Iowa Healthcare. Thanks so much for coming on the show today. We're excited to have you on.
Thank you for having me.
Absolutely. I'm looking forward to chatting more today. So to start off, would you like to introduce yourself and share a little bit about yourself?
Sure. Like you mentioned, I'm currently pursuing my first year fellowship in hematology oncology at the University of Iowa. Fortunately, I also completed a year of palliative care fellowship here at the University of Iowa. My footprints trail back to India in Mumbai, where I grew up. I did my medical school training back in Mumbai and then came here to Danbury, Connecticut to pursue my medical residency at the Danbury Hospital, after which I decided to pursue a career in palliative medicine along with hematology and oncology. Besides medicine, I also enjoy doing some form of extracurricular hobbies like yoga and dancing, which bring a sense of tranquility in me.
Awesome. Thanks so much for sharing. So you mentioned a little bit about how your journey in medicine began. So I'd like to tell us a little bit more about why did you decide to become a physician?
If I would trace back, I would very playfully say that it all started when I was in the playful chaos of childhood, where we are all exploring, and my doctor play set with those plastic stethoscope and syringes really sparked an ignition and passion at a very young age. Who would have known that I would be tracing my roots back to childhood? However, as I grew up, I come from a non-medical background family, and what I realized that I was so intrigued by physiology and anatomy of human body. Just like I would question myself, why do we find acid in our stomach when it's so corrosive on our skin? Um, when my grandfather had a heart attack, he did not manifest typical chest pain. All these questions really set my mind pondering, where I wanted to discover the unknown, and I decided to tread upon path of medicine. And here I am pursuing my HEMONC fellowship.
Awesome. Thanks for sharing about that. It's really great to hear about where your journey has brought you so far. So since you mentioned you're in your first year of fellowship at the University of Iowa, I would like to tell us, what has your first year of fellowship been like so far?
Well, first year of fellowship, like everyone says, it's a steep learning curve where you are constantly juggling with it's so diversified that you, at one point, you're seeing something different, and next day brings together a new learning opportunity where you're seeing a different form of cancer. It never gets mundane. Everyone is so collegial here, where everyone is just like a knock away at the doorstep to approach whenever I'm in doubt. It's definitely be fulfilling, rewarding, and I couldn't have asked for a better fellowship training.
Awesome. That's really great to hear. I'm sure there's always so much to learn, and it's a really unique experience. So,
For
awesome.
sure.
So what are some of your research interests and areas of focus that you've been able to explore a little bit during fellowship?
That's a great question. Currently, have focused my research interest on monoclonal gammopathy of renal significance. These are MGRS patients who do not get enough spotlight and highlight until they have a kidney biopsy. And by the time we discover these patients, they have ventured far into their disease advancement, where they are dependent on lifelong dialysis. So, looking into innovative treatments in these patient populations where we can salvage them from lifelong dependence on renal replacement therapies. Also, I have been focusing my research interest on frail elderly patients. These are the ones that we shy away from clinical trials. And when you delve further, you realize that they need very individualized approach, not one shoe fits all approach. And tailoring treatments to their best interest while maintaining a quality of life while also prolonging it.
Great. That's such important work to focus on to help improve quality of life for these patients. So do you have any either recent publications or projects that you're currently working on that you'd like to spotlight today?
I recently presented a poster at ASH on MGRS. I am working forward to develop a manuscript and looking forward towards further collaborations to expand the patient pool.
That's great. Congrats on the ASH presentation, and look forward to seeing the future research as well.
Thank you.
So as your fellowship and training progresses, what are some of the career directions you're hoping to pursue after fellowship?
Well, always shifting gears, but currently I see myself steering the rudder of my professional journey and developments into academic medicine. For the interest that I have is heavily focused in academics. Like I said, I want to focus my career graph not only on care of elderly patients and plasma cell dyscrasias, but also focusing on quality of life and patient reported outcomes, given I am so much focused in palliative care, looking at the care of these patients not only from a very narrowed, zoomed in lens of their physical symptomatic burden, but try to diversify and widen the lens how I focus as a clinician on care of patients by also looking at their social, relational, psychosocial suffering. And hopefully, I would be able to pick up these salient features and incorporate into my future research interest and academic training.
Amazing. Those are such exciting avenues to pursue. So, what advice would you give to medical students or residents who are considering a career in hematology oncology? What are kind of some of the biggest lessons or takeaways that you've learned so far?
Well, this is an exciting time to be in hematology oncology. Be ready to embrace a journey of lifelong learning. You will never get bored, I promise. There's so much to read. Try to get your hands on mentorship as early as you can during your training. It is never too early to start research, especially in areas that pique your interest further. And last but not the least, my mentors have always told me this branch, palliative care and hematology oncology, involve care of sicker of the sickest patients. So it can take a toll on you at times. So at the same time, maintaining emotional resilience and indulging in some form of self-care to rejuvenate yourself is the key to stay ahead in this journey and do not experience burnout.
That's really important advice to share with those who are listening today. So awesome. So as we wrap up today, our last question that we always ask everybody at the end of these Fellows Forum interviews is, what is your favorite part of being a fellow?
Well, if I had to stay perpetually a fellow, I would definitely agree to that. I know people always question me, why do you say that? But what I've realized through fellowship at University of Iowa with the fellowship core experiences and meetings, I get to interact with fellows from various other specialties and get to learn from them something different apart from hematology, oncology. And also, being a fellow gives you the perk where you can glean various pearls of practice from all other faculty members while you're molding and developing your own. And someone above you is always a knock away to, when you're in doubt, what should I be doing? Which in attending hood, a lot of responsibility comes upon you. So these are the perks that you should enjoy during your fellowship training and never hesitate to ask someone when in doubt.
Amazing. It's a fantastic answer. Awesome. So thank you so much for coming on today to share all this with us. It's really wonderful to hear about your fellowship journey and all the things you've accomplished, and looking forward to doing. So thanks so much for doing this Fellow of the Month interview with us today.
Thank you for granting me the opportunity. I have thoroughly enjoyed sharing my experience.